Back, 1 in 3 individuals will be diagnosed with cancer in their lifetime, but today we're bringing attention to the disease where time matters, and today is also World Cancer Day. So joining me on set right now is Dr. Mark Roth. He's an oncologist with St. Luke's Cancer Institute, and we're talking about pancreatic cancer. So Dr. Roth, can you tell us how common pancreatic cancer is? Because there's a rise in younger people getting diagnosed.
There is. So pancreatic cancer is not one of the cancers that you hear the most about. Breast, colon, prostate, all of those are more common technically. Pancreatic cancer comprises about 3% of the total cancer diagnoses on an annual basis, but it has one of the highest mortalities. It is the third leading cause of cancer-related death in the United States and is on track to become the second leading cause of cancer-related death by 2030. It is also on the rise in young individuals under the age of 50 and disproportionately among women.
Yeah, so this is something that doesn't have a lot of symptoms, because I think when we hear about the rates and the increase, they're like, what do I look out for? So is there anything that you can pay attention to?
Some of them are specific, some of them are not. So specific symptoms like abdominal pain, jaundice, which is yellowing of the skin, those are specific symptoms that require urgent attention and action. But other symptoms like unintentional weight loss, fatigue, sometimes nausea, taste changes, etc., or bowel changes, those are all more vague symptoms that you should definitely have checked out with your primary care.
So if you're worried, just talk to your doctor.
Exactly.
Type of thing. So one of the good things are there's treatment, and St. Luke's is actually doing a clinical trial. Do you want to talk about that?
Yeah, we're very excited to be part of one of the clinical trials using RAS inhibitors to target pancreatic cancer. It's one of the hottest areas of research in the world of pancreatic cancer. This particular trial is really aiming at deepening the cure rate in patients that have received curative surgery and chemotherapy, because one of the unfortunate realities about pancreatic cancer is that even when we cure it, it has a really high chance of coming back.
Okay, and I was telling you a little bit earlier on our streaming channel WDF+, I know 2 people who were diagnosed with stage 4 and are thriving completely in remission for decades now. So it is possible when we hear kind of scary stats. Dr. Roth, thank you so much.
Thank you.
Alex?